Medically assisted death, otherwise known as MAID, continues to remain a controversial topic. There is a stigma that surrounds MAID, and at times it is this stigma that affects the ability for some to place their beliefs aside and focus on patient wishes. My name is Lisa, and I will be presenting my closing remarks for my Nurse 609 Trends and Issues Assignment 2 debate that publicly funded hospice and palliative care settings should be required to provide medical assistance in dying, otherwise known as MAID. According to the Government of Canada, in 2020, there were 7,595 cases of MAID. The primary settings for those administrations in Canada were private residence at 47.6%, hospitals at 28%, palliative care facilities accounted for 17.2%, and long-term care facilities sat at about 5.7%. MAID is a fundamental right. It is meant to preserve the dignity of our patients through their life and as they near death. As a palliative care nurse, working in both the hospital and community settings over the past 16 years, I have seen good deaths, bad deaths, and have participated in MAID within my role as a nurse. Many of my patients reported the ability to make the choice to have MAID and to be given the support to proceed with that choice was a gift. Although my opponent does support a person-centered approach to care, my opponent also feels that hospice and palliative care settings should not be forced to provide medically assisted death, and this then removes the focus from patient needs and places the focus on the needs of the organization. My opponent feels that being forced to provide MAID in these settings is against the rights of the practitioner, the organization, and that the individuals working in these facilities do not have the expertise or education to provide this service. Practitioners do not have to support MAID. They can choose not to participate, but they should be focused on the needs of the patient and provide them with alternative practitioners. Healthcare should be unbiased, patient-focused. The patient should not be denied this service based on the organization's views or level of comfort. The lack of education and training is not a valid reason to deny someone their right to choose their own path at end of life. There are many resources to support ongoing education and training to perform our duties as nurses, and MAID should be no exception. Patients want and deserve a choice. They want to feel that they have a choice at the end of their lives to decide where and how they will experience death. MAID should be viewed not as a way to hasten death, but as a compassionate medical treatment to end suffering in healthcare. If we do not focus on the patient wishes, we risk decreasing autonomy for patients, we risk not providing a death filled with dignity, and we risk providing care based on the needs of the organization and not on those of the patient. MAID should not be about where, it should be about why. For all of the reasons in my previously submitted opening statement, rebuttal, and in these closing statements, I strongly encourage you to support my position that all hospice and palliative care settings should be required to provide the compassionate decision to provide medical assistance in dying to patients that are requesting it. Thank you.